Good morning, everybody. Christine Barconi here in the NBC4i Streaming Center. Here today with Dr. Mysheika Roberts. Just wanted to check up on everything going on at Columbus Public Health. Vaccine expansion is here in Ohio starting tomorrow. Very exciting. 40 and up. And then in just about a week or so after that, those 16 and up can get the vaccine here in Ohio. As somebody in that age range in a few weeks, I am super excited about this. And I'm sure, as are many people here in the city of Columbus, what does this expansion that was just announced by the governor earlier this week mean, Dr. Roberts, to the city of Columbus as far as getting past COVID-19?
Well, it's definitely another ray of hope and another sign of progress that we are getting closer to the other side of this pandemic. The more people who are eligible to get vaccinated, the more people who can get vaccinated. So we're excited about this expansion.
The governor, when he talked about why he opened this up, he said he talked to health commissioners and boards of health from all over Ohio about why you guys wanted to do this. Were you part of those conversations? And why do you feel like the governor was encouraged by these county boards of health, city boards of health to open it up and let everybody get vaccinated, essentially?
Yeah, so I was part of that conversation. We talked to the governor Tuesday morning, and many of us shared where we were with our vaccine slots, our appointment slots. And at that point in time, Columbus had over 1,500 vaccine slots that had not been accounted for. No one had scheduled them when we were looking at the 50 and up being eligible, as well as some other health conditions and occupations. And some of my peers across the state were experiencing similar things. To others' credit, there were some communities that said, we're not quite ready to open it up. We still need to vaccinate more in this group. But I think what we've realized is we can't sit on vaccine. It's very important that if we have vaccine, we get it out the door as fast as possible. So opening up eligibility, making everyone eligible effective March 29th will mean that we shouldn't be sitting on vaccine, and all of those appointment slots should be accounted for at some point in the very near future.
So today was a big day at St. John Arena. You guys are starting a 3-day vaccination palooza, essentially 12,500 vaccines ready to go for people for the first dose. What does that look like? What's the logistics look like in that? And are we going to be seeing more of that from you guys as more and more people are eligible?
So to be clear, that effort that's going on at St. John Arena is not a Columbus Public Health effort. That is a Kroger. Kroger Pharmacy is handling that, along with the Ohio Department of Health.
Oh, okay.
We are aware of it. We're supportive of it because it means more people in our community can get vaccinated. But that's not an effort that Columbus Public Health is involved in.
Oh, well, I think it's good that more people in Columbus outside of yourselves are doing these huge vaccine efforts. Are you guys going to be hosting a big effort like that in the weeks to come?
So what we will be doing starting the week of March 29th is at our Celeste Center, we will move to a regional vaccine clinic. And so that means we will be accepting anyone from around the region to come to the Celeste Center to get vaccinated. And the Ohio Department of Health will be supplying us with more vaccine. We are hoping to get up to maybe 3,000 people a day vaccinated at the Celeste Center. But what's going on at St. John Arena is some leftover vaccine that the state had that were not used by our nursing home colleagues. And so they're trying to get them out into people's arms as quickly as possible and partnering with Kroger to use that vaccine.
Okay, now I understand. Thank you for that clarification. I really appreciate it. Speaking of logistics, opening up in on March 29th in that 16 and up age group are going to be a lot of people, Ohio State students and other students who are from different parts of the state, different counties, even some from out of state. Have you guys considered that when factoring in the numbers of vaccines that you are going to need with those tens of thousands of extra students in that age group?
Absolutely. And, we're in conversation with OSU on a regular basis, and OSU is factoring their student population into their needs, and we'll be conveying that to the state. We'll be looking at other colleges and universities in our areas. But again, anyone who lives in Ohio is really eligible to come to our clinic. And so we will not turn anyone away regardless of residency status.
That's good. So today, every Thursday, we put out a story getting to that 50 per 100,000 threshold. That's the threshold set by the governor to have all health orders lifted. Do you think that is a good threshold? And how quickly, perhaps, with what we're seeing the numbers in Columbus, how quickly do you see us getting there? Do you have an estimate? Maybe summer, maybe late spring? What are you thinking?
Well, Franklin County and the state are kind of hovering around the same number in terms of cases per 100,000, about 170 cases per 100,000. So, with our current status and the current rate of disease activity, we could get there in a month or so. It's really hard to say, and it's hard to predict what the next few weeks will look like with the influx of new variants that we're starting to see here in Ohio, as well as the travel. Obviously, it's spring break season, and so we've got lots of school districts that are out and lots of people that are taking advantage of that time and traveling, and that could bring more variants and more disease back into our community. So we just need to watch and see what March and April brings before we make any real predictions of when we might reach that 50 cases per 100,000.
Do you think that's a wise thing to do right now, traveling for spring break if you are unvaccinated?
Well, I think without following the public health guidance, and CDC has been really clear, discouraging people from traveling. But if you are traveling, whether you're vaccinated or not, you should follow all of the mitigation efforts that we've been putting in place. So you should make sure you wear a mask. You should watch for social distancing. You should stay home if you're sick. So if you're a little bit sick before you get on that plane or before you get on that road trip, stay home, see what it is, get tested. And obviously always wash your hands.
Of course. Are you comfortable with that 50 per 100,000 threshold? Say we do get there in a month or 6 weeks or so. Are you comfortable with all of the health orders being lifted, especially that mask mandate? Or do you think it should be a little bit longer?
I'm very comfortable with the goal of 50 cases per 100,000 of relaxing some of the health orders. I have some concerns about removing the mask order. And as you might recall, the city of Columbus did put in a mask order prior to the state. So we could lean back on our own mask order if the state does lift the mask order.
Some people have also suggested before the health orders are lifted, we should hit a certain percentage of vaccines. Right now, the state and the city are hovering right around 20%. What are your thoughts on hitting a percentage for vaccinations before the health orders are lifted as well?
Yeah, I like that idea and I'm supportive of that idea. I would like to see at least 50% of the population vaccinated. But, we'll see where we get when the health orders, when we reach that 50 per 100,000, we'll see where we are with the number of vaccinated. But that is not part of the goal that the governor has set.
So you had mentioned that on Tuesday, you guys had about 1,500 appointments open. Do you guys have any open appointments now that threshold has been lowered to 40 in different groups as well?
No, quickly after the governor made that announcement on Tuesday, those 1,500 slots were taken up within a few hours. Columbus Public Health will open up vaccine slots for next week, starting tomorrow morning at 8 a.m. We'll have about 7,000 appointment slots available. So I would encourage people who are eligible, whether they're eligible tomorrow, they should go on tomorrow morning, check it out, and sign up for an appointment slot for them and their family members and come down to the Celeste Center and get vaccinated.
Are you guys still using the 2-dose vaccines, or have you guys gotten a supply of Johnson & Johnson, and how do you decide who gets what?
That's a great question. So primarily we've been getting Pfizer. That's what the state has been giving us. We've gotten a few doses of Johnson & Johnson. When I say a few, we've gotten probably less than 500 doses thus far of Johnson & Johnson that we've been distributing. It's really first come, first serve. So, if we have vaccine at the Celeste Center that day, we ask individuals, do you want Johnson & Johnson? And we will offer it to them again as long as supplies last. We anticipate starting the week of March 29th that we will have an equal amount of Johnson & Johnson and Pfizer.
Oh, that's great news for people who just want to get that one shot.
And we also, I should say, we also plan on sharing with the public that, on these days we'll only be offering Johnson & Johnson, and on these days it'll be Pfizer, so that people know when they register what vaccine they're getting.
So these slots are filling up, but it seems like perhaps before they did, there was a little bit of hesitancy. What can we do as people that provide public information? What can we do better to get the word out there that the vaccines are safe and that people should get vaccinated? And how are you encouraging people to get vaccinated at this point?
So that's a great question. And we really don't know why we had those appointment slots available. It could be because of hesitancy, which I'll address in a second, but it also could be because that, there's a surge, there's a rush of people going to our website the day that it opens. And then when people are unsuccessful, they give up, they might go look elsewhere, yet all those slots aren't full. And so if you come back maybe 24 hours later, you'd have success getting an appointment through us on our website or through our call center. So I think that's part of the reason why we had those appointment slots open. But another good reason is hesitancy. And I think some people are still a little reluctant and concerned about the vaccine because of the newness of them, because of the uncertainty that they believe exists. I will just reassure people that, thus far here in Franklin County, we've had over 240,000 individuals who've been vaccinated with one of the 3 vaccines, and we've had minimal to no adverse events reported. It's a safe vaccine and it's an effective vaccine. It went through the appropriate clinical trials, and we strongly encourage people to consider getting the vaccine, make a plan, and get vaccinated.
When do you hope, what's the goal to get anybody who wants a vaccine after the 29th? What's the goal to have everybody who wants a vaccine to be able to get one? Do you think it's going to take a month for that 16 and up age group? Do you think a few weeks? What are you thinking on that?
Well, it's hard for me to tell you that without knowing exactly how much vaccine we're going to get. Mm-hmm. And not only how much we're going to get, but also the other vaccine providers will get. Like right now, most of our hospitals are getting upwards of 3,000 doses a week. And then our smaller retail pharmacies and grocery stores and FQHCs are usually getting about 100 doses a week. In order to really meet that demand, and what we estimate is starting March 29th, over 1 million individuals here in Franklin County will be eligible for the vaccine. Okay, to be exact, I think it's 1,019,000 or something like that. And so we've only vaccinated 240,000 of those individuals. So we've got over 750,000 people to get vaccinated. I'm optimistic we'll be able to get them all vaccinated within 4 to 6 weeks if vaccine supply really picks up and meets the demand.
So on that timeline, it kind of looks like we might be all vaccinated for the 4th of July. How are you feeling about that? What do you think? We're going to be down on the riverfront?
I think that it's not about all vaccinated, but those who want it would be have the vaccine. It looks like we would meet that timeline of the 4th of July. Now, what 4th of July activities look like, I can't say, but most people who want the vaccine will be vaccinated by the 4th of July.
That sounds like great news to me. Dr. Roberts, thank you so much. Anything else that I didn't ask you that you want the public to know right now in this phase that we are in with COVID-19 and getting everybody vaccinated?
Well, I would just remind people we still need to be diligent. We still need to follow the mitigation efforts. And I also would ask people to be patient, give us a little grace about getting this vaccine out. None of us have ever experienced this type of vaccine push out before. So we're learning all together collectively, but we're doing our best to get the vaccine in the arms of individuals who want and need the vaccine.
All right, Dr. Roberts, thank you so much for your time today. We always appreciate catching up with you.
Thank you. Take care.
You too. All right, guys, I was talking to Mysheika Roberts, Columbus Public Health Commissioner. We thank her for her time. If you would like to check out this entire interview, you can do so up on NBC4i.com. You can also check out the requirements for getting vaccine and the timeline Ohio has set for that. Starting tomorrow, those 40 and up and those with certain conditions are eligible for the vaccine. And then on the 29th, which I believe is a Monday, those 16 and up, that's basically everybody the vaccine is approved for at this point, are eligible go for the vaccine. Like I said, more information on NBC4i.com. NBC4 Midday starts here in about 10 minutes as well, and you can hear more about the vaccination process here in the state at that time. We'll see you later. Bye.